Hello, and thank you so much for joining us here on the Health Professional Radio. I'm your host, Neil Howard. Our guest is Dr. Andy Shore, and he's joining us on the program to talk about the public health impact of pneumonia and also the need for additional antibiotics and treatment options to be available. Welcome to the program today, Dr. Shore.
Hey, thank you so much.
Thanks for taking the time. Give our listeners a bit about your medical background, if you would.
Sure. So I'm an academic pulmonary and critical care physician. I run the pulmonary and critical care division in the MICU at MedStar Washington Hospital Center in Washington, D.C., and I'm a professor of medicine at Georgetown. Was
this something that you pursued as soon as you got into med school, or have you always been interested in this field, or what was it that led you to this?
By about third or fourth year of medical school, I knew I pretty much liked taking care of sick people, and so that kind of directed me towards pulmonary critical care.
Now, we've all been hearing about the severity of this year's flu season, but let's talk about the public health impact of pneumonia. We haven't heard a lot about that in the news. Is that something that's being undercovered, or is it something that's so normal that we're not hearing much about it?
Yeah, I think you're correct. I think there's a lot of complacency when it comes to community-acquired bacterial pneumonia, or CAP, when we talk about community-acquired pneumonia. You know, Osler identified it as the captain of death a long time ago, over 100 years ago. And in fact, Osler himself, the father of modern internal medicine, died of community-acquired pneumonia. So it's a huge problem, and it hasn't gotten a lot of attention. In fact, we haven't had really new interventions for community-acquired pneumonia short of vaccination in the last 2 to 3 decades. And we actually haven't moved the needle in terms of mortality for community-acquired pneumonia in about 30 years. So this remains a really rather severe problem, and whether it's a de novo problem when the patient just comes in with community-acquired pneumonia, or as we've seen in this flu season where, you know, certain bacteria are leading to superinfections after influenza, it's really a challenge, especially since our armamentarium is limited and we're seeing resistance patterns change for the common pathogens in community-acquired pneumonia. It's kind of viewed as the price of doing business. Yet, I can tell you as an intensivist, I've had people who are otherwise healthy, who are young, die of pneumococcal shock and pneumococcal septic shock. And so that's still a challenge and a problem. And so we still need newer tools and newer options in our toolkit to address it. From an antibiotic perspective, there's been a lot of focus on agents other than the fluoroquinolones or cephalosporins and macrolides, and we're finally starting to see some of the fruit of that kind of come to fruition in terms of those efforts. So we're finally getting newer drugs into clinical trials, so we can actually evaluate them as a new option for community-acquired bacterial pneumonia. MRSA got a lot of attention, 2 decades ago, and now we have all these tools for MRSA, but MRSA, methicillin-resistant Staph aureus, is actually on the decline. We've gotten a lot of attention focused on highly resistant gram-negatives, such as carbapenem-resistant Enterobacteriaceae, or CRE, and now in the U.S. we have basically 2 and perhaps soon 3, 4, 5 agents that are going to be approved for CRE. The number of patients who die from CRE each year, or CRE infections each year, is really quite small compared to the number of people who die of community-acquired pneumonia every year.
Does this seem to affect children as much as adults, or is it more prevalent in older people? I know it's common, but who is more at risk, and are we focusing on that population a bit more?
Yeah, I mean, certainly I'm not a pediatrician, so I can't speak to all the pediatric issues, but we definitely think of community-acquired pneumonia as a disease of the young and then of the old. But the point is, it can affect anyone. And, I think any pulmonary critical care physician, any infectious diseases physician, anybody who works in hospital medicine can tell you stories of also the, young person, mid-30s or 40s, whose only risk factor for pneumonia is they had a kid in daycare, and they come in with severe community-acquired pneumonia and end up succumbing to it. So we certainly think of it as having 2 peaks of incidence, but the burden is actually distributed pretty evenly in terms of, excess mortality and things of that nature.
Do you think that the age gaps or the difference in age has anything to do with the current treatments being less effective than they need to be?
No, I think the reason we see these differences is really because of host immune system issues and also exposure issues. Those are really what's driving it. And I don't think a novel antibiotic or a vaccine or something other than a vaccination is really going to treat that. I think vaccination is key, and we have we've certainly seen as the better pneumococcal vaccinations are used in children, effects on herd immunity, so that the burden of certain strains of pneumococcus are going down in adults because we're just getting a herd immunity effect. Nonetheless, kind of like any balloon, you squeeze it on one side and it contracts, but on the other side it expands. We're seeing other strains of pneumococcus fill the void. And when you think about what pneumococcus is becoming resistant to, you think about macrolide resistance, you're beginning to see lots of issues in terms of the choices we have for antibiotics and our need for new ones.
So do we have anything on the near horizon in development that is going to benefit us even more?
I'm not sure we can claim benefit us even more short of randomized controlled trials that really show that. But there are a couple of drugs in clinical development for community-acquired pneumonia. There's a metacycline, which is a tetracycline-based antibiotic that's been studied in community-acquired pneumonia, and it's under regulatory review right now. There's a whole new class of drugs called pyrimidines, which have been used in animals but not in humans ever. And the drug in that class is lefamulin, and that's being studied in community-acquired pneumonia. They've got one clinical trial has been done, and a second one should be finishing up very quickly. So hopefully we'll have top-line data. And I think clinicians all of a sudden are going to have to wake up from their slumber of complacency where they only know one way to treat community-acquired pneumonia and reevaluate the new tools as they become available to decide how they're going to fit in their armamentarium. Because if you keep using the same antibiotics over and over again, not only are you going to create resistance eventually, you're also going to potentially expose the patient to risks for C. diff or, potentially with quinolones, the side effects that are related to fluoroquinolones that are getting a lot of attention in both the medical and lay press right now.
Now, we'd like to learn some more. Where can we go online and learn some more and possibly some more about MedStar Health as well?
MedStar certainly has a website for itself at medstar.org, and you can certainly go there and look at the 10 hospital healthcare system that I'm proud to be a part of. And in terms of community-acquired pneumonia, I think a simple place to start is UpToDate Online if you just want to learn some high-level material. But I think the best way to really get at it is there's some excellent reviews on Medscape and on other websites for medical education that really focus on community-acquired pneumonia that can address this.
Well, I thank you for talking with us today, and I'm hoping you'll return and give us some updates as things develop.
Thanks so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes. You can listen in and download at SoundCloud. And be sure and visit our affiliates page at healthprofessionalradio.com.au.